The observer would like to advise that the following video comes with a trigger warning. The content in this video is of a sensitive nature, so please beware that the topic of this video may trigger you. The observer recommends that you consider your own mental health before you watch this video.
Took herself outside by herself the other day and had a seizure.
But they went into detail about how a stranger on a motorbike had come and rescued her. What?
Social services don't pay for a carer, she pays for herself.
Yes, private.
And social care funding.
Oh no, she just said social care funding. She's trying to backtrack. No,
She didn't get funding, she's already admitted she pays for herself.
Yeah.
To be honest.
Well, yesterday, a few days ago, someone said that she's not allowed out by herself, and that's not the safety of her; it's the safety of others.
Yeah, I don't pay for private care and stuff.
Someone said that, and I thought, oh dear.
Can you guys hear me?
Yes.
Yeah, just about.
I've never gone live before, so I don't really know what's happening.
I don't know if you see my message before we come on, but do you know when you commented on a video about a barium swallow can't be done down a tube?
Yeah, so the NG tube it's sort of uncommon in some aspects. Like, it's very rare for it to be placed down an NG tube if you're able to swallow, and Kirsten doesn't have dysphagia.
She swallows, does she? Because she drinks Monster all the time.
Yeah, so she doesn't have dysphagia, which is you can't swallow, so she wouldn't need it.
I was just going to say, because Kylie had hers down her tube, so it can be done, but Kylie can't swallow.
Yeah, it's very uncommon. And same with, like, she was, oh my God, the seizure thing, right? You know how she's telling everyone that she's paralyzed from seizures? You can get temporarily, like, lose the ability to move, but I've literally searched every medical thing possible, and there is no cases in which a seizure has caused paralysis, like permanent paralysis.
And it's normal. Someone else said this last night. Well, there were another doctor in here last night that said practically the same. It's very uncommon for it to happen. Hi everyone. Right, do you want to do a poll on what the topic's going to be today then? Please, anyone?
I'm on it.
Thank you.
I was going to say I don't know how to.
I don't either.
I can't do it. I'm in the box.
Last night, or wrote down notes in a little notebook that she clearly doesn't have, because she keeps forgetting her lies. Because she basically literally retold what that doctor said last night.
She told me a comment before where she was going on about Keppra, and her daughter Kepra's all of a sudden changed since yesterday. But that'll be because of what we said.
Someone posted in the comments, they said damage paralysis usually only affects one side of the body. So seizures can cause strokes, which is technically what that is, but it's very unlikely. And she literally would not have any sort of function the way that she does if she had a stroke. Like, she basically would not be able to swallow. Sorry.
His doctor said it yesterday as well, and she said for him to be paralysed from the waist down like she is, like she says she is, and she's no movement or anything like that, that's mainly through a spinal cord injury, not a seizure.
100%. I have a... Sorry, go on, next.
Sorry, say for instance, right, she does have seizures, which she doesn't. I've seen a video that was a load of bullshit, but say she does have seizures, right? She, like, in the hospital, because I work in a hospital, if patients are prescribed, like, proper epileptic medication and stuff, doctors and nurses will not withhold that. They cannot withhold that because that's malpractice in itself. And two, there's no way that she could spend like 3 to 4 days having seizures and no one's come in to check on her. If you've ever been in a hospital, there's nurses continuously coming and checking in on you like every 30, 40 even an hour. There's no way. And it definitely can't cause paralysis, and not to mention she has no muscle wastage at all. If she's been paralyzed for the last 3 years, her legs would be basically fat and skin and bone. That's it. So she's not paralyzed. We're just going to debunk that in itself.
She's listening because she's literally talking about it. It's just because I didn't talk about it at all today, so I don't know why they're talking about it.
Stand up, no hate.
Does it matter, love?
The paralysis thing is the one thing that absolutely does my head in, because I've got personal experience with paralysis and, muscle situations and stuff like that. And nothing adds up, and it's just a complete mockery of people who are genuinely going through shit. And excuse my language, I'm one of these people that I say what I think, gets me in trouble, but it's a mockery and it's disgusting.
I just want to say something as well before this live continue. Everyone has their own personal experience of different illnesses. Not everyone's symptoms are the same. So say if someone's symptoms doesn't add up to what yours does, or you haven't experienced what that person's experienced, doesn't mean the stories don't add up.
I've seen in one of her
lives,
lives, she's blocked me ages ago now, but she said in one of her lives that she's been paralysed for 5 years, not paralysed, in a wheelchair for 5 years. However, she literally lived in my house for a good couple of months, and when she came to me, she could walk perfectly fine. I've been in a wheelchair for years. I could still walk when she came to me, just a little bit, but not much. But then she got her own electric wheelchair. She ordered it when she came to my house, and then got in it and kept saying that she couldn't walk even though she could. And she used to storm off when she lived with her parents. She used to storm off when she was having arguments with them on long walks. Like, I'm sorry, but like that was 3 years ago.
What, she lived with you?
Yes.
Kirsten lived with you?
Yeah, before I knew that she was a massive fake, we were friends, because I was stupid and I believed her. And
You're not stupid at all, because a lot of people have fell for it. Don't call yourself stupid because you're not.
Yeah, not stupid at all.
I also want to add another thing as well with the gastroparesis thing, right? There is no active known cases where someone is born with that, and I don't think she quite understands what gastroparesis is, for starters.
Can I just say, Carly was born like she is now. Her stomach, her intestines don't work. She was born like that.
Yeah, so gastroparesis itself usually forms something else. So in infants and stuff like that, gastroparesis usually comes with other complex medical conditions, right? So I'm not sure about your daughter and what her history is and stuff, and I'm not going to take that away and make comments on that and stuff like that. But usually gastroparesis in kids comes with other complex medical conditions. So like the intestines and stuff not working and stuff like that. In Kirsten's situation, I don't think she quite understands how it works, because for starters, you wouldn't be able to drink energy drinks like that or put fluids and stuff down the way she does and not throw it back up and not be sick. She is eating food, she's eating lollies and stuff like that for her stomach not to work the way it's supposed to when you have gastroparesis. It does not make sense. She doesn't have it because I don't think she understands what it is.
When she lived with me, she used to eat things that most people with gastroparesis wouldn't touch because they're harder to digest. She would eat sprouts and stuff. She'd just have a bowl of sprouts, which doesn't make any sense because I personally wouldn't touch them because they're harder to digest and cause more pain and make me feel more sick.
Well, that's literally what it is. It just is delayed processing of the food. Literally just delayed. And sometimes in the more severe cases, it's the inability to even be able to process food at all. But she's quite literally the hyperglycemia, right? Her BGL levels are normal. How is she having an attack, for one? And two, how is she able to read the comments? If you've actually had like a hyperglycemic attack, you have hallucinations, you're sweating, you're like almost fainting and stuff like that. She is literally like able to administer her so-called own medication and stuff like that. Like, it's literally, it's so wild to me.
I do just want to add some. My little girl, when you said you didn't know if my little girl had any condition, she's got Angelman syndrome, which does affect the nervous system. So
Yeah.
obviously you've got all your nerves in your gut and everything. So
Yeah, absolutely. I just didn't
she
want
has
to.
got an underlying health condition that has probably
Well,
caused
that's
it.
what I thought. Yeah,
Yeah.
because I didn't want to make these comments if I didn't know your daughter's
Yeah.
history. So I knew
Yeah,
you'd
she's got
say
like
it in your own
Angelman
time.
syndrome. It affects all the nervous system and everything. Genetic condition. So that's
Yes.
probably.
So-
They're looking at more reasons to why her gut's gone the way it has, but they're not sure because she's just getting worse and worse, and obviously she's getting older.
And
She's
same
not
with
getting no better.
the NG tubes and the NG tubes that Kirsten has. She said she's had them in for 14 years, right? That's very highly unlikely that she would
Yeah.
have those in regularly for that extent. Like, in most cases, they would change her over to a PEG tube.
Yeah, Carly had a peg. No, she had an NG for about 15 months. Then she went to a peg. But when
Exactly.
when they changed her to a peg, they said obviously it could make her symptoms worse or it could make it better. Because at this point, they thought she just had severe reflux because she was a baby, and we hadn't been to any of the bigger hospitals at this point. But then when we went to the big children's hospital where they did a surgery at, they put the peg in, and then within 6 weeks it was changed to a GJ because it made her 10 times worse. And then that's when we found out that her stomach wasn't draining. Everything was just sitting in there, it weren't moving through her.
Yeah. So for Kirsten's case, for starters, both of them are NG tubes, for one. Two, you can't change an NJ tube at home. You can't do it.
No, you
have
can't.
you have to go to the hospital to get it done. And one, they're not going to do it the minute you rock up at the hospital. Like, you're going to be waiting there for days on end to try and get it done. And you're not supposed to have NG tubes and NJ tubes both together for 14 years. Like, it's literally, it can cause so many other issues if you were to have it for that long of a period. And say, for instance, she does, and there's doctors that are doing this, they're literally doing malpractice, going against everything that they've learnt in med school.
And she never seems to get admitted for these so-called tube changes. She goes in and 12 hours later she's out, or less than 12 hours later. That just never happens. I've had tubes before. I don't currently have one in at the moment, but I've had tubes for years, and I never got on that quickly. If it came out, I was admitted, and I was in for about a week, sometimes a bit less, because you have to wait. I had to wait for endoscopy slots or interventional radiology slots to be taken, to have it put back in.
Exactly.
Can you tell us more of what she was like when she lived with you?
There were a lot of fakey shakies. Like, my dad pointed it out once, and I didn't listen to him to start with. Like, every time I had a phone call with anyone, like, if I wasn't paying attention to her, there was a fakey shaky, or she hurt herself. Like, mostly the fakey shakies though. And I believed them until one time she had a so-called seizure, and she was literally, the way that she was throwing herself about, like, is not what a seizure looks like. Like, she'd done pretty well at faking them, like, up until that point, like, but that one, like, I was like, that's not a seizure. And also, she had no epilepsy medication. She said that the diazepam was for her seizures, but it was, like, she told me I had to put diazepam down a tube, like, and then it should stop after it went down. But at the time, I didn't know much about seizures, and I was told by someone who I know who's got a child with a severe seizure disorder, that what was I saying? That oral diazepam, even down a tube, would not work that quickly. But I didn't know that, so I just thought it was working because that's what she told me to do, but she didn't have any other seizure medication. And I believe that the diazepam was actually for her mental health, not for seizures.
Has anyone got a list of her medications that she's supposedly on? I can look and see if there's any contradictions and stuff like that. But I've also noticed
she uploaded a post on, I'm not sure which account it was, but it was a post of a list of morning and night meds. But I don't know if it was on her other account, which she just admitted she deleted because she didn't want to remember being in hospital. But the current account that she is on, she has videos from back years ago when she was in hospital. And this is nothing that doesn't make sense. Is on that profile that she's on now, anyone who's still, not on the list of doom and can see her, if you go on her profile, you will see videos from 2 years ago, 2.5, 3, where she says she wants her healthy life back. She's grieving the person she's become. Mental health, ruined her first, and now chronic illnesses. To me, that doesn't sound like someone who's been unwell the whole life.
No, definitely not.
I just want to say hello, everyone.
Hi, Emily.
Hi, Kirst. I've sent a photograph to Kirsty where Kirsten actually told me, specifically, there's a private message between me and Kirsten, where she told me in 2023 she'd been paralysed for 2 years.
I'm sure that message says 3 years.
Oh, 3 years, sorry, yeah.
Yeah, 3 years.
3 years, but 2023, that would make it 2020. She wasn't paralysed when she was with me, and that was 2021.
I know, exactly. Hi, everyone.
There's no way that she can be paralysed and have zero muscle wastage. Like, it's literally not real. There's no way. Everyone that is paralyzed, it doesn't matter where, there is muscle wastage. You're paralyzed in the arm. If you can no longer move your muscles and move that limb, your muscles are going to die. It's not possible.
100%, and I've said that for ages. And my biggest bugbear with her, and this is probably going to sound petty, but I've got Ehlers-Danlos and I'm severely affected by it, to the point where I'm not allowed to work, I'm not allowed to do certain things around the house, can't lift anything, can't move furniture and stuff like that because I have so many dislocations, and I've also got scoliosis and spondylitis, which is they go alongside the EDS type 3. Now, she says she's got EDS. I'm telling you, in no uncertain terms, if she has the dislocations in her shoulders that she claims she has, she would not be able to transfer herself on her banana board in the speed that she does and in the way that she does. It is physically impossible because her shoulder would dislocate every single time she did it.
And the way
someone
she
who also has EDS, I agree 100% with you there. Also, I never, when she was here, she never had so much as a subluxation, never mind the dislocation.
No, because she doesn't have EDS, and that's I don't know if you were on my last live. I know Kirsty was. Not my live I did the other day, the last live I did. So I don't think so.
I've not been online much.
I decided I was going to play a little game and see how many of her little fucking trolls were in my live. So I stated, and this part is true, Johns Hopkins has done research and they found the genetic marker for hypermobility EDS. They have found that. Now, what I also said was that they can test you for that now. And lo and behold, what did she say on her next live? I got tested for hypermobility EDS and they confirmed it happened. It was bullshit. I fucking lied.
Yeah, that doesn't exist yet.
No, it doesn't exist yet. They found the gene, but they haven't got a test yet. But what did she say? She said she'd had the test done and they'd confirmed it was hypermobile EDS.
Sorry, that is all of chronic health conditions and stuff like that. It's not as quick as just going to the doctor and getting diagnosed. If she has the extensive medical history that she so-called claims that she has, I don't know how and when she could have gotten these tests done if she's been housebound and unable to move and unable to do any of this stuff. When is she having the chance to go get diagnosed? And it takes months, if not years, to get a proper diagnosis.
Yeah,
Even without like a blood test or like a test to diagnose it, it took me years to get my EDS diagnosed. I wasn't diagnosed until I was 18.
I was diagnosed at 21 because I dislocated my hip bending down to pick up a ball. That is literally all I did. I was working in a school at the time as a teaching assistant, and I bent down to pick up a ball, and I felt this weird sensation in my hip. Tried to stand back up again, tried to take a step, realised I couldn't. So I kind of hobbled to the toilet because I wanted to cry but didn't want to in front of the kids. Hobbled to the toilet, lay on the floor, relocated my hip. And then I didn't go to hospital until the next day because, you know, us with chronic pain, we all just soldier through. Went to the hospital the next day, got a bollocking off the x-ray tech who said I couldn't possibly have dislocated my hip because I wouldn't be able to walk. Went back in to see the doctor, and the x-ray tech, give her a due, she came in, she apologised and told me that, yes, not only had I dislocated it, but I'd relocated it. And at some point during one of those things, I'd fractured my hip.
Oh my God.
And that was, it took me till, like, they referred me obviously to the fracture clinic. I saw an orthopaedic surgeon who said immediately, all I did was walked into his room and he looked me up and down and went, yep, you've got EDS. And I was like, no, I just want hypermobility. No EDS, thank you. And he went, let's have a look at your skin. And he stretched my skin and I was like, everyone can do that. And he went, no, they can't. And that's when I started realising all the stuff that I could do was not normal. And that's when I felt really alone. And it was an awful thing to get my diagnosis, whereas she gets all these new diagnoses. They don't affect her whatsoever mentally. From appearances, they don't seem to affect her. It's just, oh yeah, I got another diagnosis. And we made a list. Me and Kirsty have made a list of all of her diagnoses. Yeah. And we are up to like 20: systematic lupus, chronic fatigue syndrome.
I just want to say, I'm not sitting here pulling funny faces at what you're saying, Emily. I'm just trying to amuse myself because I don't know anything on the topic and I'm not going to butt in.
No, it's fine. But
I'm not pulling funny gingerbread faces at you.
It's all right, don't worry, you can pull funny faces. But like the pain that I suffer on a daily basis is horrendous. And when you look at her, when she says, I'm in pain, no, you're not. Your face doesn't look like that when you're in pain. Even when you're masking it the best that you can, if you're in that much pain, you need to push diazepam and morphine. You can see on someone's face when they're in that much pain, regardless of how well versed they are with pain. Now, literally every joint in my body dislocates. I was sat on the sofa Friday with Elliot, and all I did was moved slightly on the chair, and I was like, crap. My hip had slipped out, so I had to slide onto the floor and relocate it, and it was my left hip, which is really difficult to relocate for some reason. My right one just popped straight back in. My left one's an arsehole. So I had to relocate that. It took me a while. I was on the phone to my friend Abby at the time when I was trying to relocate it. And I screamed and I shouted, and I relocate that bad boy regularly, and it still makes me scream and shout. So her doing that, like, I've my hip's gone out again. Oh, my back's out again. My shoulder's out again. Stop talking crap. Honestly, it makes me want to scream. And I'd imagine.
Can I ask a question about the EDS? Obviously, I don't really know much about it, so I don't really comment on that. But I was reading up about it the other day. Now, she says that she had genetic testing, but online it says that there's only genetic testing for the rare kinds, not for the hypermobile that she states she has.
Yeah, see, that's because I lied on my live and said that there was a genetic test for it, because I wanted to see if she'd got people on my live watching. And lo and behold, she goes live and says, after my live, she goes live and says, I had genetic testing for it. It doesn't exist. It does not exist. I made it up to see if she would copy it, and lo and behold, she did.
So that's just proof that she's literally listening to everything and just taking whatever people are saying and running with it. Literally running with it, because she can run.
And she hasn't even bothered to bloody research it. That's the best of it, because I purposefully said it, and I was I was as convincing as I could be, and I was telling people I'd send them the link after I'd been on live. And then I'm like, obviously messaged people and said, like, look, I was talking shit. I wanted to see what was going to happen. And then I saw, I think it might have been either you, Secret Haven, or it was one of the Alex profiles that shared the video of her saying, I've had my genetic testing, I've got hypermobile EDS. And I'm sat there going, you are so full of shit. Oh my God.
I think the reason why she chooses like a lot of these like chronic conditions is because there's not enough study, like they're relatively newer in terms of like medical and stuff like that. So there's not not enough testing on it. There's not enough like information and stuff like that. So I think she specifically chooses these ones because there's not enough information on it. So she could say one thing and no one's fully able to completely confirm or deny whether it's happening or not. For lupus, I have lupus, right? And it completely destroys my life. And I joined one of her lives, I think it was last week, and I asked her about her lupus. And she turned around to me and said that her body's gone into remission because she has so many other things going on that the antibodies that attack each other have decided, I don't need to do that anymore. I'm going to attack something else.
Oh,
Same
right.
with-
First of all, I'm really, really sorry that you've got lupus.
No, it's okay.
It's an awful condition. I wouldn't wish it on my worst enemy. I mean, I might wish it on her, but I'm not going to say that out loud. But, you know, oh my God. Let's see, this is the thing.
Same with the, I got blocked. I think it was Secret Haven that posted the video about the UTIs. I'm not sure if anyone else has seen that video, but there was a girl that commented in this live that she was having like a flare up of a UTI, was catching it really bad, and I made a comment and said get Ural. Now I don't know if in the UK you guys have it, but if you do, get it. If you have constant UTIs, get this thing called Ural. Anyway, Kirsten yelled at me, was going off at me about it, saying you can't spread medical information. It doesn't matter if you're a doctor or anything like that. Don't put this information in my live. And then I said, if you guys don't have Ural, drink cranberry juice. And she was like,
I saw that.
Cranberry juice doesn't help UTIs, blah, 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 blah.
Yes,
and
it does.
blocked me. If you go to any doctor and say, hey, I have a UTI, if they don't give you antibiotics, which usually you should get antibiotics, but cranberry juice is amazing because there's certain parts in like the cranberry, I'm not too sure what it is, but it helps flush out the UTI. And if you're worried about the sugar feeding on the bacteria and stuff, you can get no sugar cranberry juice and stuff like that. So for Kirsten to be like, no, it doesn't work, I have chronic UTIs, blah, 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 blah. For starters, if she has a subpubic catheter, right, you can get UTIs, but it's less common. You're more likely to get a thing called bacteria, which is lack of hygiene, so not keeping the area clean, not washing your hands, like touching it and stuff like that. She said in a live that she has had this in for I think like 4 or 5 years and has never had it changed.
She has had it changed. That's
That's rubbish. She changed it at my house once.
I've got proof that she had it changed because she messaged me, told me she'd had it changed, and as lovely as it was, sent me photographs of it.
Oh my God, why would you send photos of that?
me-
As in a private area?
So like, that's
That's
bullshit.
right. You want to hear the other kind of photograph she sends to people. So I think that's the less invasive pictures she sent to be
Oh no,
fair.
trust
I've
me.
literally never
It
dreamed
was
of
me,
sending someone a
Carly.
picture
It
of
was
my
me that
SPC
received those
bag.
messages. I received photographs of her pads.
I
Everything.
remember you said that.
Femoral line. Have you guys been hearing that she has a femoral line in?
Yeah.
She said that in her lives before, didn't she?
The femoral
She cannot have a femoral line in for more than a couple of weeks.
Yep.
She
What
can't.
if I
It
went
can't
to
be
a home, will they?
femoral lines can't be placed in for longer than like max 3 weeks. Like max is absolute cutoff time, because if you have it in there for anything longer, you have a higher risk of developing clots and thrombosis.
Yep.
So
She said it's a special 6-month one from Germany.
Yeah, it was sent in just for her from Germany.
Was literally not. So you can't get specifically designed things to suit you. Like stuff like femoral lines, like any IV lines or anything like that, you can't get specific designed ones for you.
She forgets she's special. They send everything special for her, like a Disney Fast Pass.
I could honestly bet my life that she has Munchausen's.
100%.
It's not even glass child syndrome at this point. She's actively not wanting to get better. And if anyone comments and says, oh, you're looking so much better, she loses her shit and then comes up with 7 other conditions that she has to make herself look sicker.
Yep, 100%.
I think she knows exactly what she is doing.
Yep.
Because I feel like with the paralysis, if she genuinely thought that her legs were not working, she wouldn't use them, she wouldn't move them.
Yep.
But she does. You see it on nearly every single live. And the way that she lifts herself up and then scooches her bum down to get comfy, that's not possible at all. My brother's paralysed due to a muscle condition. It's not a brain injury, it's not a spinal cord injury, it's a progressive degenerative, and he can't do anything at all. And I said to him today,
Huntington's disease.
Can we listen to what Georgia has to say? She said she had some information on something.
So at first I'll say as well that I can't feel my leg, and the carers, I can't push myself up the bed by myself. The carers have to use a slide sheet to slide me up the bed. I can't actually get myself back up the bed if I'm uncomfortable. I had Mediquip round and I spoke to Mediquip and I showed them some of the videos, and he said there are only 2 beds available all over the country with them, and that is, I've got a Nakora bed, and then there's one that's like a Sid Hill Solite Pro 3. And I showed him one of the videos and he said, yeah, that is not a bed from us. That is definitely no bed that is supplied from us. And then I also showed him, with her grabbing the end of the bed supposedly and getting on her knees. And he said, with an air mattress, if you put more pressure on a certain part of the mattress, that part of the mattress will start to sink because it's obviously got the pressure on. So you would see her wobble all over if she was physically doing that, holding on to
with air mattresses and stuff like that, specific hospital air mattresses, you would hear them.
Yeah.
They're turned on constantly to keep
they're
the
very
airflow going
noisy.
through. Very, very noisy. So I don't understand how she has it. And same with her feeding and stuff like that. If she should be on a continuous feed. It's not just planned feeds whenever she feels like it. If you have an NG tube in, you have specific tailored meal times that you need to go through. And it's the same with her pushing the fluids through so quickly. Any common sense, not to push it through fast. Same with medications and stuff like that. You have to push it slowly in. So it's just the misinformation that she's spreading is so harmful to anyone, and telling other people how they should take their medication. I'm sorry, but where's your medical degree? You're not a nurse. You dropped out. You have
She was never even in nursing school.
No, she wasn't.
I was about to say, has she ever
when she was with me, she was about what? She's 2 years younger than me, I think, and that was 3 years ago. So I would have been 24, so she would have been 22, but she had been sectioned before she came to me, for quite a long time as well. And she
What
spent
does
most of her
sectioned mean?
late teens
Is that
in
is that a term you guys use
Sectioned is
in
like
the-
inpatient psych.
Okay, yeah, I understand now. I was so confused because I've seen everyone comment sectioned and I don't quite understand. Sorry.
No, it's fine. You're Australian, so you're not gonna get all of the terms. No, the thing is,
You're an alien, not Australian.
me and Christy sat down, because we're nerds, me and Christy sat down and actually did all the maths. And for her to have done her nursing degree, she would have had to have been doing nursing in 2020, which was physically impossible. So that means that it would have been deferred to 2022, which is when she lived with...
Well, 2021, but yeah.
Exactly. So she lived with you. So 2021 and 2022, she was either living with you or she was sectioned. So how was she doing a nursing degree? She wasn't doing a nursing degree.
Even to say, you know, maybe she studied for a couple of months, whatever, that you learn about this stuff within the first couple of months. And one tip, I've noticed videos where the NG tube has fallen out a bit. You can't just shove it back in there and hope all is well. If most of it comes out, you have to remove it and put a new one in. Because if you're pulling out an NG tube that's been sitting in your stomach and then placing it back in, you're at a high risk of infection. Like, it's common sense. And
common sense doesn't work for her, though, darling. It just doesn't. Common sense doesn't exist.
And
it's like I don't know if you saw the video of her where she was talking about using sticky things that put medication in your body.
Well, pain patch.
The pain patches.
No. The metal things.
Injectables.
The injectables. She was talking about you can reuse those so long as they're used on the same patient. And every nurse learns that, apparently.
That is absolutely untrue. I'm not a nurse. I did do some of my training, but then I got too sick and couldn't continue. And I learned how to do injections like early on. You learn it in first year. And you were taught straight away that you only go in once and then you dispose of the needle.
Yep.
Yeah,
but she told everyone you could reuse needles and that every single nurse knows that. There's no point in wasting needles if they're on the same patient.
And then 2 days later, she sat on live going, I didn't say that.
Yeah.
No, I didn't.
That probably cracked me up. Like, you know, I think I was laughing at that for about 2 days. It was, I never said that. I was like, fuck off. Of course you did.
Yes.
That's how the videos on the Alex account where she's saying that. That's the videos on the Alex account that have taken from her lives, where she's saying on one that she's end of life, and that end of life means that she's dying, and then on the next one saying that she never said she was end of life and that she was just palliative.
Yeah.
If you're palliative, well, in Australia, if you're palliative care, that means end of life. And there's like a 1% chance that you come off palliative care. Palliative care is end of life. You can't just magically become better. And not to mention, she said, oh my God, mind you, I only found out about her existence like a week ago, and I've been so obsessed with this, like so obsessed. But okay, we're just going to debunk a couple of things. So she said that she had liver failure, right?
Yep.
Just, where's her jaundice? Where's her jaundice?
Hasn't got any.
She hasn't got any jaundice. Same with obstructive bowel. That's life-threatening. It doesn't just magically go away on its own. If you have an obstructive bowel, you need to go to the hospital and they need to take measures to make sure it's out.
Yep.
Her obstructive bowels come back. She said on live yesterday that, or 2 days ago, she was like, oh, I've got another blockage. And she was saying that the poop was coming out of her NG drainage tube. I'm not
in
lying.
hospital.
How? They're both, okay, they're both NG tubes, right? They're both NG tubes. You can literally tell they're both the same. They're just one's see-through, one's not. You can also see where it's sitting as well because when you put, anyone knows when you put NG tubes and NJ tubes, you have to measure it up from the top of your ear, the top of your nose, top of your ear, around the jaw, right? And it sits like, I think, halfway down a little bit. You can see where they're sitting. There's no way in hell that she would have an obstruction like that, be sitting there on live, not in pain, not anything.
And giving herself shitloads of laxatives. You don't give laxatives when you've got a bowel obstruction either.
No.
Exactly. And number two, I reckon she just has constipation from all of the opioids and stuff she's taking, because when you take, we call them Scheduled 8 drugs.
In Chinese is that she eats.
Yeah, we call them Scheduled 8 drugs, which is like morphine, opioid, stuff like that. When you are continuously taking medication like that, it can cause severe constipation, which is why you monitor that stuff and you regularly check it and stuff like that. And also, if she has gastroparesis, one of the main things that you're told not to take is ibuprofen, because it causes stomach ulcers.
Which she takes all the time.
Ibuprofen.
She takes it all the time.
Kylie had ibuprofen once, and when she had that once, her drainage bag ended up full of blood. She's never had it again.
Yep.
She'll take it for no reason. She'll go, oh, it's a bit warm. I think I need some Nurofen.
Yeah, Kylie's not allowed that. Like, it's listed in her fingers. It's listed in Kylie's fingers an allergy, even though it's not an allergy. But because the first time she had it, it caused a bleed, and her drainage bag was full of blood. She's not allowed it ever since.
When she was with me, obviously things can change, but when she was with me, she wasn't even on any pain relief like opioids or anything. I was like, and I still am, but she kept asking to take mine, saying she was in loads of pain, and did take it more than once. Not that I wanted her to, but literally, she wasn't on any of those things. She wasn't on Oromorph or anything.
The thing with Oromorph as well and morphine, that slows your gut down. So if her gastroparesis was so bad, why is she taking it every day as much as she does take it?
Exactly.
She shouldn't be taking those kinds of medications for long periods of times. Those are short-term medications and stuff like that, and no sane doctor would continuously prescribe those over and over and over, because one, they're highly addictive, and two, your body becomes reliant on them. So I don't know where she's actually getting these medications, or if they even the medications that she says she takes, because a lot of the medications that she's so called on contradict each other. They don't work with each other. They can cause serious harm if you take them together. And a lot of the medications that she's so called on, you can't crush. If they're quick-acting medication, you can't crush them.
She also says she has a permanent headache, and she itches her palms and everything so much. Now, I know from personal experience, because unfortunately I got caught up in the whole, all these painkillers and make me feel great, let's take some more. And the headache is horrendous, and itching, it's good for an hour or two, but afterwards, the headache and everything is exactly what she says. It's not a migraine. You wouldn't be sat in a room on live.
It's because your body has become so dependent on the medication that it no longer can function correctly as what we would call normal without the medication. If she is on them long term, of course her body's going to be shit when she's not on the medication, because she's so dependent on them. She's literally a junkie. That's all I can say is she's a junkie. I don't know where she's getting this medication from, or if it's even prescribed by doctors. And if it is, I would be calling into question on who is prescribing it to her, because she has no reason to be on it. She doesn't have any of these conditions that she supposedly has. And I think the reason why she was put on the NG tube was because she had an eating disorder. that was the original reason why she would have been put on it in the first place, was because she had an eating disorder and she wasn't eating, and it was a life or death situation. That's it. And I think it's gone to her head, and she's like, oh my God, look at all of this attention that I'm getting. Now I have to be on it long term to keep getting this attention.
Yeah.
But it's causing more harm by her being on it and having an NJ tube and an NG tube for long periods of time. You cannot do that. It causes more harm to the body by doing that than if you weren't on it. And I'm sorry, but if you have gastroparesis, you would not be able to drink energy drinks without vomiting. Same with hyperglycemia. How the fuck are you drinking energy drinks? Oh, but it's sugar-free. It still has additives and preservatives. Like,
can I respond to someone in the comments? I'm trying to find the comment to see who it was again. But someone asked, can I explain why I lived with her? Mama too. Basically, me and Kirsten met through the chronic illness community online. I thought she had a lot of the same conditions as me because that's what she was saying, and I believed her because, well, I tend to take people on their word. And we arranged to meet up anyway. She lived ages away from me, but we arranged to meet up and for her to come and spend the weekend here. And that kind of escalated very quickly into her coming to stay. It was only meant to be for a couple of weeks because she was meant to be moving in with one of our mutual friends, who she totally screwed over because he was in a council house and he basically gave up his tenancy for that so that he could move in with her. They were getting a house together somewhere. And anyway, she was basically saying how she was miserable at her parents' and everything. And I thought, because she'd been struggling with her mental health massively before she came to me. She'd
Thank you, Joe.
done things multiple times to herself. And she was doing really well, which was me. So I thought, oh, well, you know, like maybe it'll help her to be here for a while. I was a bit stupid, but that was a honeymoon period of her, like, well, pretending to be something else, but I don't know. Anyway, she basically ended up moving in, but she was only with me for about 3 or 4 months because she was absolutely awful. She was nasty to me on a regular basis, and also she regularly tried to unalive herself in front of me, and I couldn't cope with it. And so the last time before I wouldn't let her back that she was with me when she tried to unalive herself in front of me again, she OD'd on my medication in front of me. I was literally hysterical and she wouldn't stop. And I'm really calm in a crisis normally, but it was just one time too many. Like one time, even once is too many. Like to do that in front of someone else. When she went into the hospital, I told them that she couldn't come back to me again, and they sectioned her. But yeah, it just happened very quickly when she moved in with me, though. Like, I didn't really think it through, to be honest.
I just scroll it in the comments saying that we're chatting shit and stuff. Obviously, people are welcome to come in and share their opinions and stuff, but it is staying, you know, not getting extreme and starting arguments and stuff, because at the end of the day, these are all people who've got personal experiences with her, who suffer from chronic illnesses, who actually go through the shit that she pretends to go through. If she was a nice person, this would all be different. No one would probably be saying anything, but there's too much going on now that is showing her out to be this nasty person, and it needs to stop because someone's going to get hurt.
Yep,
She's
100%.
doing more harm to people around her by spreading misinformation and giving out medical advice when she's not trained in that category. I'd call herself Google Doc. Literally a person that you would go onto Google and search, oh my God, I have these symptoms, what is it? And it gives you the worst case scenario. That is what she does. She gets an idea in her head and searches up the worst possible thing and says, yep, I have that. And then she goes on live and tells people how to take medication differently to how a doctor has prescribed it.
Yep.
Does she have the medical knowledge?
To Discovery B, she was sectioned because she was a danger to herself, like, not because she was homeless. Like, I couldn't have her back because, like, she was breaking me and I couldn't do it anymore. I still tried to be her friend even after that. Like, but, like,
Megan, she's
then
not a
got really
nurse.
nasty with me.
She's not a nurse. She has no medical knowledge at all. And if you are to join her live and she tells you something or what you have or how to do this or how to do that, do not listen to it. If you have any concerns about your health, go speak to a trusted doctor. Go speak to your GP. Don't get information or advice from someone on the internet that is not mentally right in the head. You shouldn't be getting information off anyone that doesn't have medical advice, full stop.
Chronically me, did she have tubes when she was living with you?
Yes, she did.
Did she have both?
Yeah, she did have both in. And one day, I got up in the morning and she said to me that her dad had come to get her in the middle of the night and take her to their local hospital to get her tube replaced. But she was back by the time I woke up, and, like, I'm pretty sure I would have heard if people were coming in and out of my house in the night. Like, I was really confused by it. But she never had an admission the whole time she was with me until she was sectioned.
Yeah,
It's
I was
always
about
the
to
middle
say
of
as
the
well,
night.
like, did she have as many tube changes? Yeah, Dion, what do you want me to say? I didn't
Not while
know.
she was with me, it was only that one that she told me about.
She
I know
said
that for a fact
yesterday.
that she bought her NG tubes from a veterinary website.
Yep.
She said
showed
yesterday
me.
that you can't have an NJ without an appointment, but yet she goes off live at 2 a.m. in the night and comes back at 4 a.m. with the new tube. Now, the amount of hospitals that I've been to, I've never had an appointment at 2:30 in the morning because I'll be telling them where to go because that is sleep time.
I wrote
There is actually.
Dion just wants me to say something. She's just said in the comments that the misinformation on cyclism, not everyone gets a high. She's on it, and it's not true for everyone that everyone gets a high on cyclism.
I wrote some like dot points. So I just want to go through a bunch of different things to sort of outline what's false and what's not. I'm not
She lived with me in 2021. Beginning with the end of, I think it was the end of 2020 and the beginning of 2021, if I'm getting the years right. But I think that's when it was.
And how
It
long
had
did she live with you for?
3-4 months at the most.
4 months. And where did she go when she left you?
Back to where her parents lived, but she was sectioned stuff, and then she got that where she is now, which was so-called temporary accommodation, but there's no way it'd be in temporary accommodation for that many years.
No, she got temporary accommodation in a hotel first, and I know that because that's when I was modding for her. And she had a landlord back then, and that was the person who I had to contact regularly if I couldn't get hold of her dad.
Yeah.
So I would be contacting her own landlord and saying, look, Kirsten's having an attack. She's had a grand mal seizure. This is going on, that's going on. And I would have to contact the landlord to get that sorted because otherwise no one would be there to go and help her.
Should be down to her family. Like, I know I don't like to mention mods, but I hate the way she puts the responsibility on the mods because that can be quite dangerous. Like, expecting a stranger online that you've never met. I mean, obviously it's different meeting someone to speaking to them online. Expecting them to sit there of all hours and watch her. They're literally babysitting her.
Yeah, we were told we were expected to stay up all night. We actually made a rota as to who was going to look after her and when. And it was our job to keep an eye on her constantly and to make sure she was never left alone online.
It's because she doesn't qualify for care, because I know for a fact if she couldn't move like she says, she would have a nighttime call with someone helping to put her into bed. She wouldn't just have 2 45-minute calls.
No.
Yeah, because
No, she wouldn't. I get more than that, and I don't have epilepsy or anything. I get 5 hours a day, and I like over 4 separate calls, and I don't have the so-called needs that she has. I don't need constant supervision or anything like that. And I get more than that, and my care's funded.
Can I just say something? I wrote down like a couple of notes to sort of like contradict what she's saying, like sort of thing. So for the seizures, like seizures themselves can't cause permanent paralysis. That's number one. The only ways that you would sort of like get permanent paralysis is TOD paralysis, which is temporary weakness, injury during a seizure, but it's highly unlikely that she would have damaged her spinal cord that way, or underlying conditions which she, like stroke, brain tumor, or neurological diseases, which we all know that she doesn't have. Same with the NG and NJ tubes. She said she's had it her whole entire life. Any medical professional, and I can say this because I'm a qualified nurse and I'm studying to become a doctor. So for number one, the risk of complications are super, super high. So prolonged use of NG and NJ tubes can lead to several complications, including nasal irritations, gastric ulcers, and increased risk of aspiration, so the food and liquid entering the airways. And long-term placement can also increase the risk of tube dislodgement or blockage. Now, she has said in a couple of her lives that she doesn't flush them out. She doesn't flush out like her NJ tube and stuff like that. And anyone knows who's had an NG or an NJ tube, if you put something down, you have to flush it out with water. Same with medication and stuff like that, because it can block. You can't just put things down and then leave the tube.
Yeah.
And then same with the femoral line. She said she's had it in for a few years. Wait, can you guys still hear me?
Yeah.
Oh, okay. She said that she's had a femoral line in for a long, long time. It's not suitable for long term. So there's risk of infections. There's thrombosis risk, which is a DVT, and risk of line displacement. And then I'm not sure if you guys saw the thumb line as well. The only reason that they would place an IV in the thumb is that's it. So I don't know why she would have an IV going in her thumb, which I looked at the video and it's completely sitting wrong for starters. And two, the way that she was explaining it on how it was put and stuff like that makes no sense to me. And I remember being in a live with her and I asked her, you know, why don't they put it in like your arm, like sort of in the inside of your elbow, because that's the normal place that they would put an IV line. And she said that her veins are like not working, you can't place them there. And the only reason I can think of as to why that your veins are so tiny and you're unable to put a line in is regular drug use. That's it. Regular bad drugs, and it makes your veins really tiny and hard to put in. So like people who use like heroin and are continuously shooting up with needles and stuff like that, you can no longer use those veins because of the continuous drug use. Does that make sense?
Yeah, 100%. And the thing is with Kirsten, she says so many things that, like, at first they make sense, and I think that's how she gets her victims, for want of a better phrase. And like I've seen a lot in the comments, and I do just want to say, anyone who's fallen victim to it or fallen prey to it, please don't think of yourself as stupid or anything like that, because you're not. You just saw someone in need, you felt that they were in need, you supported them. That's all that there is to it. There's nothing to be ashamed of there. I've modded for her from 2022 to 2023. I modded for her for 18 months and I fell for everything that she fed me, because why would someone lie? And that's the main thing that you think about when you see things like this, the exposure lives. You go, why would she lie about it? And she lies for money, and she lies for attention because she knows that this is the best way to get attention, especially off her family. And she likes the attention. She likes the attention she gets from being the sickest person on the planet.
Hi, Emily.
Hi, darling.
Am I allowed to speak in a minute?
Yeah, oh, of course you are.
Thank you.
If you decide, well, if you tell her that you're sick, unless you are a trusted person who she's known for ages, you're blocked, because obviously you can disprove the crap that she's saying. That's all I wanted to say.
Could I have the sorry, I'm still new to this, but could I speak for a minute?
Yeah.
So I totally hear where people are coming from, but the vein thing and the repeated like drug use, lots of people who do have like EDS and other conditions do have terrible veins. So I'm one of them, and I have had cannulas in my thumb before. It was last option. It was like the last like point of call, but I have had them.
That's what I said. Yeah, that's what I said. That's what I started with. I said it's absolute emergency. She said on a live that she had it put there because she could not use any of the other veins or anything like that because they couldn't find it and it was too tiny and stuff like that. But she doesn't.
Yeah, it definitely is used for like last resort. But it was more just the repeated like drug use and things. Like I've got terrible veins.
The repeated drug use was just specifically for her, no one else, just her.
Yeah, I just thought it was like, I should say, just because like, just
no, that's okay.
You don't have to have bad veins from just repeated drug use, because like I've got a central line, a portacath. One of the reasons was because I'm so hard to cannulate, but yeah, lots of times. I'm not saying that repeated drug use doesn't cause bad veins. I'm just saying it's not the reason. I think that, like, you know, it can happen from, you know, other reasons. But I just thought I'd mention it.
I'm just specifically talking. I said earlier, I'm not talking on anyone else's situation. It's just her. So any like stuff that I say is just specifically aimed at her. No one else.
Okay, that's good to clarify, because I think people in the comments were quite confused just because you kind of said drug users rather than Kirsten herself.
Yeah, it's just specifically aimed at her. So for anyone that joined like recently and stuff like that, all the information and stuff is just specifically aimed at her, no one else. That's
it's like the like cannulas and stuff. I feel like emergency is a strong word as well. I think it can just be used as like a last effort.
Resort. Yeah,
because I have
because I've had cannulas in my thumb before as well when I've been in hospital, but I've got horrendous veins because I've been cannulated and bled so much and spent so much time in hospital, but they only do it if they have to.
Yeah, exactly. It's like, it's not the first place you choose, but if it's the place that they can get it, they get it.
Yeah, so usually the thumb specifically is just for last resort. So normal people who don't have like extensive long chronic conditions and stuff like that, the first place you would do is in the arm, or you would do you can do the jugular vein and stuff like that, but places like the thumb and femoral and stuff like that is more last resort. They'll try every other possible place first. But Kirsten, if you look in the video, there's a video, I can't remember which page it's on, it's not sitting correctly, and she's able to bend and move her thumb around. If you have a line in there, you can't really move your thumb.
I mean, you can, but it's just not, you might,
it's not easy. If you're moving it around to the extent that she was moving it around, it's going to come loose. It's going to fall out.
As a wheelchair user, I tend to ask them to try and not go there if they can help it, because obviously transferring in and out of my wheelchair means that like that cannula's not even going to last long anyway because I'm moving it too much.
Yeah, but you can't move it.
I'm going to do a little poll now. I want to know how many people in this live have actually been affected by Kirsten personally, or if they've just come across. So, sad face if you have, happy face if you haven't.
I don't really talk about, like, I know a lot of people are probably thinking that, oh, you know, was I an ex-mod? Because obviously I've made a page, but I think my experience, I never chose to be a mod because I'm a grown, like, I don't want that responsibility. But she basically told me that my illness, my disability, my diagnosed disability was not real. I didn't need a wheelchair, didn't need an electric bed. And I think it angered me because my brother's got the same thing. And he's at end stages. The thing with my illness is it's terminal, it's life limiting. So for her to sit there and say it's all fake while she is shoving tubes up her nose, that made my mental health dip. So I blocked her. Then I came across her again the beginning of the year. Oh, she boils my blood.
Yeah. She has that effect on a lot of people. And like being a mod, my mental health, oh my God, it was in the floor. I was so ill and my partner was begging me to stop modding. And she told me that if I stopped modding, then it would be my fault if anything happened to her.
It's literally sick Olympics with her. Like, if someone says that they're having a flare up or they're sicker, she has to be like, no, I'm sicker. Like, I have this wrong with me. And every current live that she does, her literal.
Just let me address a comment in here, Martha.
There's a comment as well that I'd like to address as well.
Okay, Martha, but you're all saying she's fake, yeah? And I'm not being funny unless you've been on the receiving side of her. Don't come in here making your shitty comments.
Yeah.
I'm just going to say...
I'm not being funny or anything. I'm the first person that will say shit when it comes to her for what she said about me and my child. So don't come in here with your fucking shitty comments.
I'm not being funny, Martha, right, but Kirsty's a fucking friend of mine through Facebook, and her little girl has got the same condition as my boy, and what Kirsty's been through on this fucking app, there is no need for it, and that Kirsten is giving a load of fucking bullshit. Like, there is fuck all wrong with her. She does make out, like, if you go to Tenerife, she's been to 11 Reef, and I've only been watching it the past few weeks. And
the thing is, what people tend to forget, because they come into the live and all they see is people are ranting, people are pissed off, yada yada. Now, what they fail to realise is, one, we have a right to feel that way because of what she's done to us, and two, we have the evidence to back up everything that we say. I've got the evidence to back up everything she said to me, including all of her conditions, when she became paralysed, which I sent to Kirsty. We've got all the evidence of her actually not being paralysed, of her not having gastroparesis, because we know that she could eat, and she sent me photographs of food that she's eating. So she hasn't been tube fed since she was a kid. There's an actual news article on ITV News that proves that she hasn't been tube fed since she was a child. So the evidence is there. If you actually bother to go and research it, you'll see all the evidence, and then you'll know.
Emily, can I just reply to a comment? Can I reply to a comment, please?
Yeah, go on, Dion. You reply to your comment.
So someone said, why is she having a cannula in her thumb or whatever, just because when she's supposedly meant to have a central line. So lots of times, like, I've been into hospital, even though I've got a central line, there's lots of times where they have either not had someone in A&E or wherever to use it, but also if there's any kind of suspicion of an infection, whether that's literally you tachycardic, you've got a slight temperature, they will not use your line until it is fully confirmed that you do not have an infection. So when I go in, if I've got a slight temperature or I'm tachycardic, they will not use it at all, and I will have to get a cannula, but I still have a central line. So I just wanted to put that out there, that she can still have cannulas and have a central line. It is.
Yeah, I can vouch for Dion on that, because Carly's had central lines, and when every time she spiked a temperature, they weren't allowed to touch her lines apart from drawing the blood back.
Exactly, to try and
the reason that they do it is purely because they're not sure if that line is causing the infection. So they can't use something that could potentially be the reason that's causing the infection. Exactly. So they'll usually put something else in and stuff like that.
Which is why people still get cannulas, yeah.
Yeah, and I just want to say as well, Becca that was speaking before, her little one's got Angelman syndrome as well, so she knows how difficult it is for a child with Angelman syndrome and the daily struggles that children with Angelman syndrome go through. Yeah. So for Kirsten to say what she said about me and Carly, It's unreal.
And it automatically
also
affects
just
me,
want
which is
to
why I
add
put
as well, for anyone that has an issue with us coming forward and speaking the truth, you don't understand that people like her are the reason why it takes people with actual chronic health conditions so long to get diagnosed, because people like her come out and they spread all this information and they pretend that they have diseases and stuff like this, and it makes actual people with chronic health conditions look like idiots. That we're not trustable and we're not believable. So people like her and what she's doing is causing more harm in every kind of aspect possible, because she's spreading absolutely false and bullshit stuff. Like, 1 minute she has diabetes, the next she has hyperglycemia, right? But her levels are normal and she's going into these fits and stuff like that. Or if you ask her, how's your lupus? Oh, babe, don't worry, I'm healed. My antibodies are just attacking other things, so I'm in remission. And that's giving people who, for instance, like me, I have lupus. If I was not understanding of how lupus works and stuff like that, I would look at her and hear what she's saying and feel shit about myself and have these images of, oh, maybe I need to get sicker for my lupus just to go away. It's just absolutely freaking crazy, the shit that comes out of her mouth, and she can't even remember half of it. And she's giving medical advice to people on how to take their medication and stuff like that. Like, what?
So if I interrupt quickly?
Yeah, of course.
I know that she's listening, or someone is listening and feeding back to her. I would just like to say, Kirsten, your safety is not at risk. What do you think we are? Who do you think we are? This is awareness, not hate.
I'm on the other side of the country. I'm doing this because I've seen
say
far
that
too
again,
many
because I
people.
didn't hear what you said.
She just said, can you tell me if my safety's at risk? She's twisting it and making out we're all going for her.
But yeah, when she's threatening
Yeah, we've not said anything about her. We're all adults, and this is awareness only, Kirsten. That your safety will never be at risk, so don't even twist it.
If you want to jump on live and put your whole life online, expect people to comment about it and say something about it. You can't jump on live and
people in my comments. People in my comments that will say like, "Oh, this is intrusive." It's social. She's posting this on social media. If she doesn't want people to know what's going on in her life, don't come on social media. Why don't you sit there all day and FaceTime your mods? If that's what you want, you say that.
She's also saying, I don't want to be known for my sickness. Like, I'm tired of hearing about it. I'm sorry, but your whole personality is based on being sick. That's all you've got going for you.
She said to me that I was rubbing in her face that I've got a sick child. Now, if she was as ill as she was saying, why would I need to rub it in her face that my child's poorly?
She looks well. She thinks it's like some sick Olympics where if someone says they have something wrong with her, she has to be 10 times worse. God forbid she looks good, or someone says she looks better.
She makes people doubt their own illness, because I definitely did. I had an issue accepting my diagnosis, because obviously being told at a young age that, oh, you know, your muscles are going to basically fall apart, not work, you're going to be in a wheelchair.
And you go through grieving.
That's what I mean. And she's put posts up in the past saying that she's grieving her old life. So if that's the case, she should understand that you need to be supportive. You don't sit there and say, well, you've got that, but I'm worse, I'm more poorly than you. It's bullshit, absolute bullshit. And I hope she is watching this.
Even that literally contradicts itself, because she's like, oh, I'm grieving the life that I used to have, but you were born apparently with gastroparesis. Like, you were, so how can you grieve a life that you never had? Which one is it? You were well and you were fine, and then suddenly something happened, or you were born with gastroparesis? Which is
But her contradictions as well. They're not always even from 2 years ago, different stories. She'll literally tell you a story in the morning, and by night time, it's completely changed. I've never met someone who's got such an interesting life.
Yeah. And I hope to God she's got mods and stuff watching it, because I hope they wake up.
She's just, I don't know if that was a threat under her breath. I'm going to have to look back on my recording.
Yes.
Freaking Aura. She doesn't know when to stop opening that mouth, I think. She's going to get herself into trouble.
Why? What did she say?
Justice.
To me, it sounded like a threat underneath her mouth again. She's like, I know who it is. And then she said something.
She's sitting there and said on live that, expect people at your door and it won't be me. But yet when we're sitting here discussing things
She probably thinks it's me since she knows where I live. And she's obviously going to know my
what is she going to
voice.
do? She won't do anything. Her way out of the paper bag.
She is all mouth and no trousers, unfortunately.
I'm sorry, but if she is as sick as she says she is, she's not going to have the energy to go and track you guys down, like, realistically. And if she does, then she's not as sick as she makes herself out to be.
Really. I don't know how she has the energy to sit live.
If she is genuinely as sick as she says she is, for all the conditions that she has, she is a freaking cocktail of sickness. How the hell can she sit on live for hours on end, bitching and complaining and doing all of this? I'm sorry, but if I was that sick, and I'm so sick, I'm sicker than everyone else, how the frick can you stay on live?
And her whole life revolves around setting up that camera and pushing meds every hour. She doesn't watch TV, she doesn't go out, she does nothing but sit on a live, be patronising, tell her mods what to do, get people to babysit her, panic when an ambulance is called, pushes things up her snout and then passes out. That is her life, and it's really sad to see.
At what point do people at some point, part of me feels bad for the mods, but at the same time, I don't, because a lot of them are just as nasty as she is. Like, they completely shut down everything. They're rude and stuff like that. And it's giving cult, very much cult vibes. But at what point...
I have opinions on the mods, not like bad opinions against them, but I obviously I'm not going to say it out loud because I'm not here to talk about her mods, but I generally don't think they believe her like they do.
I do think there is one that's very vulnerable who is still a mod, and I think we need to be a bit careful. Because some are extremely vulnerable that are her mods and have been manipulated. So I just think we need to tread a bit carefully with that.
That's why I said I'm not really talking about
some of them that I do feel bad for. Like 100%, it's so like you don't want to believe that someone's lying about something and stuff, and it's so easy to be influenced and stuff. But there is a certain mod, and I'm not going to name names. She is nasty. She is just as bad as Kirsten. Just as bad. And I just, it's so annoying. It's giving cult vibes.
But Kirsten sees herself as their leader, and she says this all the time. Now, if I was in a group of friends and one of them turned around and was like, yeah, well, I'm their leader, excuse my French, but I tell them shut the fuck up because no one's above anyone. So I don't understand how, obviously I know some of them are vulnerable and are, what she tells them is obviously brainwashing them. But for some of the others who maybe do have the same mind and, aren't as vulnerable, 100% you'd be like, well, why do you think you're better than me? You're not a friend if that's how you think. And she speaks them like shit as well.
One day I think
Yeah, should we now try and get the boxes with people that have, been affected by her, and they can tell their story if they feel comfortable to do that?
Yeah, I feel like that's good for people who maybe don't know a lot about it, because hearing the things she's put people through makes you realise that, she's not just someone who's pretending to be sick. She's actually someone who doesn't give a shit about people's feelings.
Kirsty, I can share mine if you'd like to start off and then hop out.
Yeah, and if anyone writes in the comments what if they want a box for personal experiences with this girl, then we can do that if you really want to.
Yeah, that sounds like a good plan.
Yeah, I'll mute then and I'll let you go first, Dion.
Okay, so it's like one of those things like where do you start, because it's so much. So I was actually friends with Kirsten for quite a while. Back in, I'd say more January. I don't think it was even late. I think that was last year, I think. And then I only started realising this stuff when everything started to come out. So the main thing that I was confiding in Kirsten was that she had similar conditions, supposedly, to me, and she also had similar medical devices. So she'd have and medication. So I would kind of go to her because I didn't actually know anyone who was on the same medication. So I'm on IV cyclozine at home, and not many people are on the IV cyclozine at home. So I tried to confide in someone who I thought I could trust, and it'd be okay for a while, and then for one day she just turned and started saying that I was faking everything that I was doing, and that I was faking having a central line, and that I was faking having IV cyclozine, and that I can't get that because no one can get that, and everything. So that obviously really, really got to me, and I was like, it was literally out of nowhere as well, and I would feel like I'd have to send. So I sent her a picture of my prescription, picture of the actual medication with my name on it and stuff, because I felt like I had to justify myself. I felt really like I had to justify myself in just what I had, and which shows that I think it kind of speaks volumes in when you speak to Kirsten and stuff, that she doesn't show evidence. When she even questioned me and started having a go, the first thing I thought of was I'm defending myself and I'm sending all the information to prove that I have this stuff. And she doesn't do that, obviously. So that kind of put me into a place where I was kind of getting a bit questionable. So over the time, I kind of started to think, at this point, I didn't think she was faking, or whatever we're going to call it, I didn't think at this time, I just thought she was being nasty. But I started to realise little things that she would say that to a person who wasn't chronically ill, they would make sense. But to when you have the same conditions, and you know what goes on with those conditions, you kind of know a lot more than the surface. It's like she's just Googled the conditions and just read surface level information and not gone deeper. So there'd be times where her central line that she had, so I've got a portcath, and she'd be like, oh, I had this and this central line, and her chest would be bare, of no scars, nothing, and I'd just, it'd ring alarm bells and think, because I've got Ehlers-Danlos syndrome, I scar really, really bad. So the sites of where the scars are, where they've tried I've had 2 portcaths, so one on each side, and the scars are very visible, very horrendous, and just very noticeable. And her whole chest is very bare, and she's apparently had Hickman's ports, the lot, really. And then there was one live that I saw that she had a suspected port or central or Hickman or whatever she kind of classed it as, and it was a subcut line attached to her chest, and it would just, that's kind of when I kind of knew, okay, that's kind of crazy, because it wasn't a central line, it doesn't look like a port, it doesn't look like anything I've seen before, because I obviously know the different needles and stuff that go in a port, and it didn't look like the line itself, where the clamps and the bung and everything at the end is, just didn't look right, and it would there'd just be certain things like that she would do that would really spark confusion and then, because I felt really, really betrayed though when I found out all this information that she was faking, and whatever we're going to call it, faking, whatever anyone else wants to call it, because I just really felt really betrayed, because obviously I confided in someone and I felt like I should. It just really, really, that was I've got autism as well, so it really, really, I trust people sometimes too easily, so it really got to me. But yeah, just lots of misinformation from her, and I just wanted to pop on and say the misinformation I have seen from of the awareness accounts is not true too. So I just wanted to put it out there that lots of things can happen and lots of areas are different. So even though we know Kirsten is different, she's a whole entity herself. I'm talking more generalised. Every area in the UK is different. Each hospital has different rules, different protocols, different practices. Some people use aseptic technique with central lines. Some people use no touch technique. It doesn't mean any one person's correct. It just means that everyone's different, and I just feel like it needs to be known that just because someone comes on and says something that there might be a medical professional or something, it doesn't mean it's true, because lots of places are different. And yeah, so in this live there was a lot of misinformation at the start, and I wanted to hop on and say that part first because that was really concerning. And
It wasn't me with the misinformation, by the way.
No, it wasn't. It wasn't anyone here now. It was just, yeah, it was just a bit concerning because lots of it wasn't true. So, yeah, exactly. Someone put in the trying to debunk. Exactly. It is a bit concerning though. There are lots of the misinformation happening to try debunk Kirsten, because it's not right either. So I think people need to just kind of take everything with a grain of salt, really, because we're not. Even me, I've got a central line. I know quite a lot about the medical world, being chronically ill, but I wouldn't give out or say what is right and wrong, because I know everywhere is different, because my hospital does something different to a hospital down the road 20 minutes away. So I think we've just got to take everything as it comes, and everywhere's different.
I always try to say on the post, mostly about the paralysis, I always make sure to put in the caption that my opinions are based on what Kirsten has said about her paralysis, because obviously everyone is different, but from the things that she said in the past she can't do and then goes and does it, or the things that she said, like, you know, the whole can't move at all, that's what I base my post on. But people don't read the caption and then comment saying, oh, well, you know, I can do that. And I'm like, I understand that, and I don't doubt you can. Like, that's amazing. But this is solely based on the information Kirsten has given about herself.
I would like to put it out that Kirsten is her own kind of entity, and she is her own crazy. So whatever kind of she does, we kind of all know what's going on with that. But I'm just more talking for people who put in, oh, well, I know she doesn't have a portacav or a central line because she doesn't hep-lock her central line. Lots of, like, I don't hep-lock my central line. Lots of places don't do that anymore because it was proven that it actually didn't do anything. But I know lots of places still hep-lock central lines. But someone did put...
hep-locking children, because Curly's line did always hep-locked. Even when she had her line in February in her jugular and her neck, they had, because they've got 3 ports on them ones, haven't they? They used to hep-lock the 2, or if they weren't using one, that were hep-locked, but the other ones weren't. I think they do still in children, but I'm not so sure.
They're still doing adults. They're still doing adults too. It's just area to area. Lots of areas don't do that anymore, because it was proven that flushing worked just as well as hep locking. But it also doesn't mean your hospital doesn't hep lock. But someone in the comments were on a video trying to raise awareness for Kirsten, was saying, oh, she doesn't have a central line because she didn't hep lock her line, which is like, again, misinformation is coming out kind of left, right, and centre. And I think everyone needs to just kind of keep it in their minds that everywhere is different. So don't just because she doesn't do it. We all know Kirsten is her own person, and we all know that she is definitely her own entity in all of this, but I'm talking more just in general. But it was great to speak to everyone, and I'm going to hop off, but I just wanted to make sure that the misinformation was kind of getting talked about too, because it was a little bit concerning. But thank you for letting me speak.
That's great. It obviously needed to be said as well. So, you know, like, instead of in the comments, it's someone actually saying it.
Yeah, it is sometimes it is needed just to kind of back up. But I'll speak to you later, Kirsty. We'll go with Emily later.
Yeah, I'll speak to you later.
See you later.
Bye, thank you. Yeah, and I just want to clarify as well with things that I say, it's from personal experiences from me and Carly. It's not something I've read on Google or got out of a textbook. It's what I've seen personally, if that makes sense. Does anyone else want to come up, or does Chronically Me want to continue talking about when she lived with Kirsten?
Phoenix is trying to get back in.
Yeah, well, I'm going to try and leave the boxes for people now that want to talk about personal experiences with her, because I've noticed with Kirsten, if you have the same person in the box talking, she reports it for bullying.
Oh, really?
Yeah, because it's the same person saying things. It gets classed.
She doesn't like hearing the truth. She doesn't like people exposing her.
No, and that's why I try not to talk much and I stay quiet, so then she can't accuse me of bullying.
I'm literally waiting to be booted by mods or whoever comes in and reports, but I don't really care, to be honest, because these things need saying. It's harsh, but it's the truth. It's not even harsh. You know, no one's sitting here and saying she's this, this and this. It is literally people sharing their experiences and talking facts of how they felt by the way they were treated by her.
Yeah, exactly. And some people have been treated absolutely awful by her. And I know I sit there and people, like, I've had a few comments over the past couple of weeks with lives like, why are you always talking about what she did to your child? Well, what she said about you and your child, because it's disgusting. And I don't care
what she said about Carly.
And I don't care what anyone says. 3-4 years time, I'll still be shouting from the rooftops what she said about me. I don't care.
It's your page and your live. You can say whatever you want on it. If they don't like it, they can leave.
Yeah.
Also, I've heard from other people.
Absolutely disgusting what she said about us and what she accused me of. Now, Becca's gone in the box now, but again, let's say your little one's got Angelman syndrome, and the condition, they're the happiest little kids, like you've probably heard, are laughing in the background throughout the live, but the complications that come with the illnesses, the condition, is absolutely awful. And to be accused of making us sick is, yeah.
That's disgusting.
It's just like self-reflection of herself, innit, really? Trying to self-reflect.
She treated me horrendously when she lived with me, though. Like,
yeah, well, I'll mute now then. If you can, I'll mute and you can tell your story now. I'll mute now.
Like, I mean, I don't really know what to say, but it's like she treated me absolutely horrendously. Like when she lived with me, I was so scared that if I showed that I was upset by something that she had said to me when she was being nasty, that she was going to try and unalive herself. So I had to constantly hide my own feelings and tell her that it was okay how she just treated me, even though it wasn't. She'd regularly kick off at me, and I can't remember exactly what she said because we're talking years ago now, and it's just, but she'd be just vile, the things that she'd say, and make me. There's multiple times that she made me cry, and I was just so scared of her trying to unalive herself because I genuinely cared about her, even though she didn't deserve it, I couldn't have a relationship with anyone else other than her. She had to have my constant attention all the time, and I did everything I could to help her, but it didn't make any difference in the end, really, to be honest, because she just she's doing it to herself. I do believe she has mental health issues, and she's definitely got Munchausen's, without a doubt. Watching her fake seizures, which I thought were real at the time, was scary. I knew what to do. I thought I knew what to do. I know. I was trained to be honest. I know what to do when someone's having a seizure, but being in a wheelchair myself, there wasn't really that much I could do anyway, because I couldn't position her properly because I can't stand or walk. I wasn't strong enough to reposition her myself to get her into a safe position in a seizure. And the medication that she was making me give her isn't even seizure medication anyway, not in the way that she was making me give it to her anyway. But she is a nasty piece of work, and she faked seizures all the time. Like, she was constantly draining from her NG tube, like with syringes and with a bag. Although anyone who's had an NG tube to drain with before knows they don't drain very well with bags anyway, and it's easy to just aspirate from them. But she got all of it. Like, she once had feed center, and she told me it was from her dietitian, but it was literally this massive box of feed that was all just chucked back, like just chucked in there. Like, it wasn't in like nutrition boxes, even though she said she was with nutrition.
Chronically, me, can I just ask you a question?
Yeah, of course you can.
Are you safe from it? Because at the minute, there's a lot of people in the comments saying she is fuming because she's listening.
You've got like smoke at this point.
She knows her life.
Her face, she is going absolutely insane. Are you safe?
I hope so. She knows where I live, but she lives ages away from me, so I hope so.
If she lives, you should. Yeah.
You might not. I don't think she will, but you might get a message or something. I don't know, because she's very clever.
Probably, if you get a message, it'll be off their
on
dad.
literally every platform. She couldn't message him. She'd have to get one of her cronies to do it.
Yeah, exactly. She probably would. But what I'm saying is just be careful. I don't think she will. She's very clever and she's very manipulative. She's going to twist it. So
Does
just
that
be
not
sure.
just scream guilty though?
Yes.
Like,
That face.
if someone is saying this stuff and it wasn't true, you just be like, oh well, let them say it. I know the truth. But she's literally sat there with smoke coming out of every orifice in her body because she's so angry.
She's listening then.
Yeah, she'll be. You know what? Everyone else talking, no reaction. You start talking, her face changes instantly. She
Nothing
changes.
I'm saying isn't true though. I'm literally just saying what's happened.
I'm tempted to come to her.
I'm just more bothered that you're going to be safe.
Well, I have carers come in 4 times a day, like for a minute or 1 hour at a time. So, but I mean, as long as she doesn't give anyone my address that could actually get to me, she's kind of giving herself away by trying to get to me in the first place, because she says she can't get the hat. She says, yeah, exactly, she wouldn't do that.
No.
Because that would just give her away straight away.
That's what I mean. It screams, I'm
She's going
guilty.
to do it another way, but she's going to get a dig at you somehow.
Well, no
I don't know what, but she's clever.
No,
Or she'll say all this because she'll want people to stop. It's like with when she sits there and she goes, "Don't worry, it won't happen for long. It's all being sorted." And what is being sorted? She's sharing things on social media. People are picking up on her lies and debunking the lies. There's nothing illegal about it. I've got a recording of her saying if they want to screenshot and record, they can. So I'll just use that and say, well, there's the permission. She said I can do it.
Exactly. I know for a fact she's lied about me on her own lives before, because I've been told by people that I know. And my friend Sabrina, who unfortunately passed away last year, she used to watch Kirsten's lives too, and also was so angry about the fact that Kirsten was lying about these things. And Sabrina had bad seizures, and lots of health issues. But Sabrina had told me that she was saying things about me, like how my house was dirty and messy all the time, which is not true, actually. It's not. But when she was with me, it was a shit tip constantly. Like, I'd try and get one room sorted, and then she'd have by the time I got to the next room, she'd have trashed the room I'd just sorted again, because she was so messy. And that's just me speaking the truth. She had loads and loads of stuff. I've still got some of her stuff in my shed. I can't get it out because I can't get in the shed myself. But when I've got time with a carer to get it out, I'm going to get them to get it out, and it's all going in the bin, because I don't have the space for it anyway. I don't want to have crap in my space anymore. It was in the house for ages. Most of it got taken back by her parents, but they never came back to get the rest of it. I tried, but I'm not paying to get someone else's crap back to them.
It makes me sad that she, treated you that way, given your situation. It is heartbreaking to think that she did not think at all for 1 minute, well, how was she feeling? you know, should I be doing this? Should we be treating her that way? And you can tell she is a messy person. She pulled her fingernail off the other day and flicked it into the corner of her room.
Oh, that's disgusting.
She spilt a Monster drink as well and was like, oh, well, that'll have to stay there till the morning.
Well, doesn't she empty her catheter bag and stuff and her drainage bag into a bucket under her bed?
But then she'll go into the kitchen.
I would never do that. It gets emptied down the toilet where it should be.
But she's got a full accessible wet room. So why doesn't she use it? Like, no one's asking her to get in their shower chair to empty it. Pick it up, wheel it, put it in between her legs, because we've all seen her carry things in between her legs.
Exactly. It's not hard. Like, I hang my catheter bag off the side of my wheelchair and then it gets emptied down the toilet, like, whenever it needs emptying. Like,
That's what I mean, yeah.
I don't use load bags because being in a wheelchair, it's too hard to get to them. But, like, it's, like, my catheter bag gets changed every week, like it should be, and it gets emptied down the toilet, and alcohol wipes to clean the end of it to help prevent infection.
Well, she was messing with her femoral line yesterday with no gloves, no anti-bac, rubbing her nose, rubbing her hair, and then touching her femoral line. Now, that is a huge infection risk.
It's a massive infection risk.
Which also screams not a femoral line. And also, if you listen, when she pushes meds or puts her fluids on, you can hear drip, drip. I think she's got it stuck to her leg, and then it drips into a bucket.
I've got a picture somewhere, no lie. She knelt forward once, and her central line. You know when you've got your cannulas in, and then you get the extension that you screw onto the cannula that they put the fluids onto and stuff.
Yeah.
It was one of them. You could see the end of the extension that weren't attached to anything.
That's what I mean. She doesn't. It's like when she wears a little short and she's rolling around in bed, and there's nothing there. Absolutely nothing. Now, unless her femoral line is literally at the very, very top of her groin, which I very much doubt so, because it's not like just a little tiny line either, and it has to be covered up. So you'd see the bandaging. There's nothing there.
Alive where she had a so-called extension on her femoral line that was coming out the top of her t-shirt.
That wouldn't happen either.
She pulls it up.
Oh, how long would that extension have to be to reach from there, like, to where her femoral line goes, come all the way out the end of her t-shirt, like out the top of her t-shirt?
And also, would she be able to move the way she does with a femoral line? I've never had one, but my common sense, obviously this is just what I think, it's not medical information, but my common sense is saying, like, whenever I've had a line or a cannula, I don't want to move too much in case it knocks it, but she's literally doing backflips and cartwheels in that bed and not worrying about the line.
And like someone pointed out today as well, like if she's completely paralysed, you know when she said that her last femoral line had fractured? If she's completely paralysed and she can't move and she's like there doing nothing, how did the line fracture?
That is true, actually.
How did that happen? When
she said she woke up blood and then said that it was a pile of blood, but obviously her legs don't move, so they wouldn't move in their sleep. It's not a paralysis when you're awake type of thing, it's paralysis all the time. So how? And she said her legs don't move in a seizure either, which is not true, because you know I've got videos of her kicking the camera, so it goes back to watch her. It was like when she had the seizure on the couch and the camera moved fully, and then all of a sudden you just slowly see the camera move around back in shot. I was wetting myself. I was like, that. She's literally moving the camera back.
Yeah, I've got a video like that once. When we first come across her, me and my partner were watching, and the seizure were pretty convincing at first, and then he spotted it. He went, "She's just moved the camera." Luckily, I was screen recording anyway. And I watched back, I was like, oh, fucking hell, she did. You just see her, like, stop seizing, pick the phone up, move it back onto herself, and then continue again. It's like,
yeah, because she has to be in shot.
It's like, but come on, that's not like, I've never seen Carly Like, start having a seizure. Hear Cocomelon on the telly, stop, have a look at it, and then continue seizing again.
Because she sits up halfway through the seizure, reads the comments, goes, I don't know what's happening, and then starts shaking again.
Yeah. Like someone said here, it could still fracture, to be honest, with seizures, etc., but they wouldn't fit a femoral line with seizures, which is a fair point. And plus, you won't have a femoral line at home anyway.
I can't see properly. Sorry, I had to.
But then, like, she says she can't see properly, but then she reads the comments.
Because she hasn't got her glasses on. I take my glasses off and I can't see properly either.
Yeah, her live Rach just said, what's going on? A good question, Kirsten.
I showed my brother's partner as a doctor. He's a locum at the minute. He's been uni, proper doctor. And I showed him one of the 10-minute ones, and he was literally sat there like, what is she doing? Like, why is no one there? It's 10 minutes. He said that is not what it would look like, because he's obviously dealt with many of them. But I just think, are you like not embarrassed? Like, if I cough in public, I'm like, oh my God, did anyone hear that? And she's there throwing herself around.
Adele, leave my little gingerbread man alone. He's cool. I like him. And to be fair, I don't want people to take me seriously, to be honest. I love my gingerbread man. He's just chilling. The chicken sound one, absolutely terrible. Oh, don't. The chicken one. The full video of having a seizure sounded like a chicken. Honest to God, I must have been laughing at that for about a month. I'm not going to lie.
But don't get me wrong, she is trying to perfect them. She listens to what people were saying, and she tried to incorporate them into her fakey shakies, but it's still not good enough. It's obvious, like, and there's been a lot of people who do suffer from seizures, and like yourself, Kirsty, you witness seizures, and it's a fact that not one person has come forward and said, no, they do look real.
Exactly. And one thing she's never going to be able to perfect with a seizure is the fact that, I'm not going to say everyone, but most go blue.
Yeah.
Carly goes blue round the mouth, and I've got plenty of videos, because obviously if you don't record these days, it didn't happen, did it? But I've got plenty of videos where Carly, who's Carly? Where Carly is blue round the mouth, and you can see she is blue. Now, the only way she's going to be able to prevent that is if she buys one of them, do you know them lollies that turn your tongue blue?
Oh yeah, that.
Get one of them, lick her lips, but even then it still wouldn't be believable, because it'd be too bright blue at that point.
That's what I mean. You can tell by her colour as well. Like, obviously, you said everyone is different, but I'm sure if anyone was in a 10-minute seizure, their colour would change, especially when she holds her breath. I notice she holds her breath, and then she can't hold it any longer, so she does this big, like, exhale.
Yeah, exactly. And like when Carly has, and to say that when she has seizures to the point where she says it affects her airways, then how can she make the noises that she makes? Because when Carly's had seizures, the only sounds you can hear with Carly is her struggling to breathe. Now, I'm not saying people don't make sounds in seizures, because people probably do, but I've never personally seen that.
Yeah. I think there's obviously a lot of things that, and like everyone is different, but with everyone having different experiences, they're all coming together and saying, well, I don't have this, I don't have this. So it's obviously just her special. She must have special treatment as well. Oh, she paused. She's paused. I'm so tempted to come to her.
No, you can't click in, you'll get blocked.
No, but I can come to her from the outside.
Do it.
She also, if you're watching the live, she will go and look at your account and see who you're following.
She doesn't know. She doesn't know who. She doesn't know our ghost accounts. She would have to delete all of her 16.1k followers to find out who the screen recorders are.
Yeah, my ghost account isn't friends with her, I just follow her, and also there's no posts or anything on my ghost account.
I'm private.
Someone's just said she's ended her life. She's probably going to come in here.
Do you know what? I'd love her or dad to come in and have a civilized conversation.
She will
actually love that.
never
Well,
do that.
I'm not being funny about, but I don't think I could have a civilised conversation with her, not going to lie.
No,
But
she never do that. Never.
She did, didn't she? Back in June it was, when I was like watching In Her Lives. Someone came in the box. I think she got fed up and she was like, do you know what? I'm just going to accept someone. And someone came in the box and was like, well, why are people saying you're faking? And she was like, I don't know. She was pale as a ghost, panicking. That's when she said, well, she didn't mention gastroparesis. She said, I've got chronic pain, I've got chronic illnesses. And then she was like, it's also suspected EDS because that's what was mentioned to me. So she admitted that she's never been diagnosed with EDS.
She did that in one of her lives, didn't she?
Yeah.
See, I had a seizure in the past that actually did stop my heart. So when she said that she has CPR and she can move completely freely, she, like, even cough, she's not in any pain, is she?
Nothing.
She's just had CPR.
I couldn't move. I couldn't breathe. I couldn't do anything without being in severe pains with my chest. My chest was also very, very bruised.
But she has CPR, comes home 3 hours later, and she's back to doing cartwheels on her bed again. That would not happen. And she said she had CPR for the respiratory arrest. Now, I know that if you're in public and someone is not breathing, you know, start CPR. I know that, but she said it was with the ambulance. Now, as an ambulance crew, wouldn't you see that, okay, her heart's working, but she's not breathing, so we'll just bag her?
Yeah.
Yeah, and we were talking about this yesterday, and I said this about, because Carly, when she had her surgery in February, she couldn't breathe. Now, she was in distress with her breathing. Now, she didn't need CPR or anything, she just needed extra breathing support.
See, with Kay's seizures, she's not stiff, is she?
No.
She's all floppy.
She does like dinosaur arms. That's what she does, and you know, all her fingers aren't even stiff. Like, she tries to make it look like it is, but you can see that it's not.
There was once when she was like, during the seizure, I don't know if this has been mentioned, how she like holds her breath and then she gets away from the camera, and then you can hear her kind of like
exhaling.
Yeah. And
100%.
That was one that I saw, like, she would go through this cycle, like, shake for a couple of seconds, get her breath back, try and not have a sneaky look at the comments, then do it again. And it was going through this cycle over and over and over. And then there was one time when I was actually on her live before I got blocked. This wasn't a seizure, it's one of her in and out, you know, the fakey floppy things. I don't know what, they're not seizures, they're like when she goes in and out. And she was doing that and she couldn't talk to anyone, she seemed like out of it. And then within a second, she's like, oh shit, I haven't taken this med. And then is able to do a banana board transfer on her wheelchair to go and get this medication. And then she gets back in bed after getting this medication and again is going all floppy again.
Yeah. Can I just say, Apple user, I think talking like this isn't helpful personally. What can be done to stop her and get offline? Firstly, I'll say that I'm finding it very helpful to talk about this, and I'd hope that other people do as well, because it is a lot having to hold in, you know, what you want to say and how she's treated you. No one should ever have to keep that to themselves. Like, I've always said, my messages are always open, even if it's not about the situation, someone just needs someone to talk to. send me a message. I will reply and I'll always help if I can. So firstly, I do think that's very helpful. And also, I've had a lot of people message me who have said, I'm so glad I found your page because I believed her and she asked me for money. So it is helping in that way. As for the safeguarding and stuff, authorities are aware of what's going on. It's just that a lot of things can't be said on the internet about that sort of stuff because obviously it's a bigger thing than just sitting on live and talking about it. I feel like the lives are more for, you know, talking about your experiences and also discussing things she's said and how it doesn't add up and other people's situations. That's more what it's about.
I find these lives helpful. I mean, getting to talk to other people who actually see through her crap, like, because I was calling her out, like, for crap way before it became a big thing where lots of people were calling her out. I kept getting called a bully because of it, because I would say, because I would tell the truth. And getting to talk to other people who actually know that she's not telling the truth and who have been on the receiving end of her is actually helpful to me in that way.
Yeah. I love how Jessica said get counselling. Jessica, I am in counselling. I sent my therapist to therapy. That's how bad it was. But then again, counselling isn't for everyone either. So
Yeah, I just say Blip's comment. It's important not to mock her or hate her. You here are all respectable. Do you know we're all adults? We're not little children. Do you know what I mean? Like we're all respectful. The only thing we're doing is people are talking about their own personal experiences and relating it back on what Kay said. Kay, you know, Kirsten is spreading very, very dangerous advice online that is not going to end well eventually, either to herself or others. And no one's ever said horrible words towards her, had made out, you know, like saying nasty names, calling her names. Not once. Not once.
yeah, she is still a human being. She does need help.
She is.
There's probably a lot of things people could say about her, but not on here. Like, keep that to myself, what I want to actually truly say, because that's not for a public platform like this.
Oh, I could say a lot, but I'm not gonna.
That's what I mean. It's respectful. Like, I'm not respectful in my own head, but when it's in public or on a platform like this, it is respectful.
One day, someone is gonna. How do I put this without getting blocked? Someone is gonna be unalived by her advice.
Didn't that already happen?
I did see like rumours of that.
No, we're not gonna talk about it because we're not 100% sure, and I think it's still investigation, and I don't really want to put it in the live because we're not 100% sure ourselves.
Okay.
And it could, do you know what I mean? Like, you might have heard it elsewhere and that's up to them, but I just think if we put it, we don't know the facts on that because nothing's been put out there. And I think, you know, if everyone starts accusing Kirsten, then she'll probably get off at it, to be honest. But what I'm saying is just that we don't know facts, so it's something we can't really talk about, if that makes sense.
It's a dangerous accusation.
There's a comment in here as well where Kirsten's told people to stop taking their epilepsy medication. Can I ask why she told you to stop taking it? What was the reason for her to say that to you? Because again, if she ever tells anyone to stop taking medication, don't stop taking your medication unless you speak to a doctor first. Please don't stop taking medications.
Yeah, just take what you're
dangerous to stop taking. Yeah, that's very dangerous.
Yeah.
It's like if I would have listened to her when I first come across her, because she told me that she shouldn't have a limit to lose out of a drainage bag, but there is a limit because it messes with your electrolytes and all your potassium and everything.
I'm just hoping it gets to enough people and then there'll be enough people in here that know. what she's like.
It's about the awareness and people who maybe have come across her and don't realise actually what's going on. And I do think the pressure is getting to her because she's slipping up a lot more. And the thing is, you know, people would have sympathy for her if she just admitted to what she's doing. I know for a fact that, you know, I'd happily speak to her and help her even if I could, if she just admitted that she's got a problem with pretending to be ill.
Yeah, if she admitted to it, there'd be a lot of people out there, wouldn't there? Like you said. But it's the fact that she's not. I just thought, what do the ambulance people do if they get called? They've probably got a regular caller plan for her.
Yeah, the people are, like I said, some things can't be said on live, but people in her area, authorities, know about her and are aware of what's going on.
I used to be called a frequent caller, but it was for, like, genuine reasons. Because I used to fall a lot. I was using a banana board and we were waiting for input from physio and I was trying my hardest to get using it. And I kept falling. But now I'm in a better place and we've got a hoist now that's on a ceiling track, so I don't fall as much. But when I used to have the ambulance out quite regularly, yeah, you'd get attitude towards you with some paramedics.
Which it shouldn't be that way, but unfortunately it is people like her that makes it that way, basically.
It's like when she's having the fakey shakies, I bet an ambulance comes. So,
well, she doesn't like people calling the ambulance. That's another thing as well, that, like, really, I find it hard to... If I had a family member who was having a 10-minute seizure, I ring an ambulance every time because a 10-minute seizure is dangerous. But her dad walks in, picks up the camera, says, "Hi everyone, good night, I'll sort her, thank you." And I'm like, help her. Do you know what I mean? Like, you wouldn't just be on camera saying, "Good night, everyone."
You'd be checking your daughter's okay first, wouldn't you? Before addressing the phone, you would go over to your daughter or your child that's having a seizure and go over and check they're still breathing.
Yeah, exactly. But
we're probably not to call an ambulance if she had a seizure. I didn't listen to her. If it lasted longer than 5 minutes, then I called one.
Yeah, because it's dangerous.
Exactly.
I just want to address a few comments in here about people being muted and stuff like that. If you've been muted or been removed or anything like that by any of the mods, then you've been removed for a reason. No one gets muted for no reason. There's a reason behind it. They've seen comments or things that have been said that shouldn't have been said, so that's why people have been muted. Sorry, carry on.
just catching up on the comments.
It's like, yeah, with the seizure that I had that my heart stopped, I was in Tesco's, I was able to go out at that time. And that was scary. Like, it got to the point where I was thinking, if I hadn't gone Tesco's that day, that I may have not have been found in time and gone. And yeah, I remember how much pain it was after that. Like, you couldn't move, you couldn't breathe, you couldn't do anything without being in serious pain. And there was one screen recording that I saw one of her mods was saying, "Oh, I think I'm coming down with a cold, I feel so stuffed, I feel all stuffy," and things like that. And then she does such a forced cough and is like, "Oh yeah, I think I'm starting to get a chest infection because of the mouth-to-mouth CPR I had."
But she's got a mouth guard hanging up on her wall but yet she says that, you know, she's giving people and getting chest infections because of the mouth to mouth without a mouth guard. Why would you buy a mouth guard and not use it?
Mouth to mouth without a mouth guard, and they wouldn't do it if they had chest infection themselves.
Yeah.
That's what I mean. Carers as well.
That mouth guard was bought by an ex-mod, and I've got the receipts of that as well.
It's like an ornament for.
The Observer, providing you with the latest TikTok drama from across the UK.